Secretary.
Good morning.
Good to see you again. Just a couple questions for you this morning. I know that I happen to be the co-chair of the Prescription Drug Abuse Caucus. I know that there's a lot of funding throughout the budget for opioid abuse. There was one account that was zeroed out. I assume the access to recovery account was zeroed out by the administration. And my assumption is that there are other resources in other parts of the budget, realizing the fact that more people are dying because of an overdose than from auto accidents or gun violence. Would you talk to that so that would help some of the folks that I'm hearing from in their concerns?
Yes, I think this gets to one of the topics we've talked a little bit about is making sure there's not overlap in programs and that we are doing that. In the proposal and the money that we've asked for in the opioid space, there is specifically money around naloxone and Narcan. And even last year with existing funding, we have moved those monies out. We're trying to work on this on two fronts in terms of helping people with the overdose portion of this, and that is through our funding and helping communities. But we're also working with the private sector to make sure that it's taking steps to be able to access it. I think you probably know that in a number of states we see pharmacies like CVS and Walgreens working with the state to do regulations to make it over the counter so that that access can occur not just for first responders, but sadly, sometimes family members need to. The other thing that we're doing across the department in this space is FDA has approved the first nasal naloxone, making it easier for regular people to be able to give it to their loved one if they need to, so they don't need to do a jab.
Very good, thank you. Next question for you. I know that you've spent some time in South Carolina. We appreciate that. You should come back more often. I'm sure they'd like to see you in Charleston. But in 2013, each state was provided with a CMS Liaison to contact with questions and issues. These were removed recently and replaced with a generic email account, and it's causing some challenges in South Carolina. It seems to be nearly impossible, according to the Department of Insurance, for states like South Carolina to get quality answers, especially answers that are necessary from a timely perspective. What I've been told by the DOI is that the respondent many times that they're talking to doesn't list their names, so this via email contacts, and it's signed basically by a regards from the FFM response team. When they do identify themselves, it almost never includes that individual's email or contact information. So the long story short is that it's from the South Carolina DOI, it's very difficult to have an actual conversation via email or by phone with a specific person that leads to an immediate response that is clear.
So two things. One, I will follow up on that. The responsiveness and customer service in this space is something, our relationships with the DOI, I need to find out exactly which part, and does it have to do with the FFM, the federal markup?
Yes.
Is that, okay.
Yep.
Well, I'll follow up in terms of that. And the other thing is this does get to the issues of resources for CMS. I think you probably know that the question of funding for these things, and this particular type of service, we can't do the fees. In our budget this year, fees that are coming in from the FFM will far exceed what we're asking for in an appropriations, which is a good thing,
Yes.
and we're happy about. But there are certain services the fees can't pay for, some of these. So as you're reviewing the budget, if you'll look at that, but let me follow up specifically on, have we changed something and do we need to figure out how people know who to contact? I hear very clearly,
Right.
We need to be able to follow up with someone, is what I'm hearing.
Exactly,
in the question.
exactly. Someone,
Well, I will
as opposed to
follow
a
up on that.
department, to a
Yes,
specific
yes,
person
yes.
to get a more of an immediate
An answer.
response.
I
And
know.
I assume that in your budget, there's some flexibility to shuffle some of the resources around?
We do, and we have done, but I'm
Okay.
sure you probably know that the funding for CMS over the past few years has certainly been an issue that has been a challenge for us, and we're hopeful we're at a different place this year.
Last question for you. I know you've already answered a couple questions about the challenges around the co-ops. The federal government has distributed about $2.4 billion in loans to 23 co-ops around the country. However, recently, including in my home state of South Carolina, we have seen co-ops closures, which will likely result in lost coverage, higher premiums, and perhaps even higher deductibles. In my state alone, about 67,000 South Carolinians could lose their insurance. Sadly, South Carolina is not alone, as we've heard so far this morning. Co-ops in 22 of the 23 states where they operate are suffering large losses, according to last year's results. And there are very few signs that these co-ops will actually be successful into the future. What's your next steps?
So with regard to the co-ops, in terms of our next steps, the consumer is at the center of our strategy and our approach to making sure that we take care of those consumers. That's why a number of co-ops came out before open enrollment, and we will continue to monitor with the states, who are the lead regulator, I think, as you know. Having said that, most recently, one of the steps we've taken is make clarity in our guidance so that the co-ops can actually seek a broader range of capital for them to have inflows as they try and work through any issues they have. But the consumer is at the center. We support the states, and we continue to monitor them closely so we understand if there are changes in the facts that they have given us.
Yes, thank you. My time is up, but thank you very much.